Hello Andrew, my name is Philip Rouleau with Rultract, and I decided after looking at the equipment at the hospital that we would have to send you an entire demo set because that equipment at that hospital is completely useless and should be replaced, but certainly useless for the minimally invasive procedure that you're going to be doing. So I'm going to quickly go through this because the hospital is familiar with how to set the Rultract up. The equipment's just a little bit different. So I wanted to walk through this with you. First of all, they're going to put their clamp on. This clamp is almost identical to what they are currently using, so they will know how to put it on. Very important here, I believe you're going to be setting up on the patient's right side. The Rultract's always set up on the right side for this procedure, or it would be in the way. That's why we're going to use extender bars. So you go ahead and put this clamp into place. And I'm sending a new top post because the top post has to have these detents in it, and it needs to have them on all four sides, and the top post that the hospital has does not. That's for safety reasons. So we're going to go ahead and put the top post on. We're going to set up near the patient's shoulder usually, but it's going to be up to the OR to decide how they want to set it up. Once you have the top post on, you would only ask for the rotating extender bar. Actually, you didn't ask for any extender bars, sorry. You just asked for the Rultract ratchet with the snap clip. So this snap clip is going to attach to the Thoratrak. That's what the difference is between what they have and what we have. We no longer sell it the way that they have it. So if they bought a new one, it would look like this. And somebody from the hospital did ask for a quote, and I did it and sent it over, so I'm not sure where that's going. I still intend on sending this to you to be at your house tomorrow. Now, you did ask for just this piece without an extender bar. The reason we're going to need extensions is if we set up on the patient's right, we need to be able to reach across the patient, obviously, to get to the incision. Now, if they decide to set up on the patient's left instead, it'll still work. The Rultract will be set up here, but the surgeon may find that it's in his way. It's really just a preference of the surgeon. But if we were going to do the way that Dr. McGinn does it, he sets up on the patient's right, reaches across the table using extender bars. So I'm going to send you both of these. What you're going to do is put the extension on first. It goes straight across the table. It's important that this tightening knob is opened all the way. So if you're in the OR and they're trying to put this on and it's not going on, tell them to open this lock knob all the way and then go ahead and slide it into position. And make sure that this lock knob is tightened down into a detent. That's why we need detents on these posts. So make sure that it's locked into position. If not, it could slide off. Now you're going to put the rotating extender bar on. This is important because the retractor needs to be manipulated. So if you don't have a rotating extender bar and you just have your Rultract on your top post, and you're connected to the Thoratrak, you don't have any way really of adjusting the angle of retraction. So what you would need to do is to put the rotating extender bar on. Now, depending on the size of the patient, if the patient's very large, you'll want to make sure that they put it on with this tightening knob on the top because you gain almost 2.5 inches of height over the table. If the patient is not large, then I would put it on with a tightening knob on the bottom. So smaller patient, larger patient. Okay, and for the purpose of this video, we're going to do a smaller patient. So again, you're going to open this lock knob all the way. If they try to put it on, it doesn't go on, tell them, open the lock knob all the way. Slide it into position. You can see there are alignment marks. Well, you may not be able to see that, but when you look at the equipment at your house tomorrow, you'll see alignment marks on it. Line it up to where it's between the alignment marks, and then again, tighten the lock knob into position. If it's not tight, it could slide off. That's why the top post that they have will not work. After that, you're going to put your Rultract ratchet assembly on. I like to have the spool over the patient with the handle going toward the patient's head. Well, in this position, it isn't going to work that way because you're going to be moving the retractor. So let's put the spool again over the patient's chest with the handle going toward the head of the patient. This way the retractor will have a little bit more leverage. So you go ahead and tighten that into position between the alignment marks. Make sure that lock knob is tight so it doesn't slide off. And then you're, again, they use this, or at least they used to. I'm not sure they still do. But they'll be familiar with how to lower and raise the retractor down to the Thoratrak. I don't have a Thoratrak here, so I can't show you how to attach it, but it's self-explanatory. So you go ahead and attach the Thoratrak, and then if you need to adjust the Thoratrak for whichever part of the procedure you're doing, you would loosen this knob. I have it loose already, and you can adjust the angle of retraction with the Thoratrak. Once you find the angle of retraction that you need, tighten that tightening knob and it'll be locked into position. So that is the setup of the retractor that I'm sending you. It's important that we use the equipment that I am sending you and not interchange it with their equipment, because their equipment's old and outdated and, as I said, pretty much useless. So that is how to set this equipment up for the minimally invasive procedure with the Medtronic Thoratrak. If you have any questions after watching the video, you can call me. You and I can do a Zoom conference if need be. Pretty self-explanatory, I think, once you watch the video, but certainly if you have questions, my number in the signature of my emails is a mobile number. You can text me if you need to. Thanks for your time. Thanks for your help. Thanks for your support. Have a good day.